Now, my PhD topic is about the perioperative management and critical care for patients with liver dysfunction. I am a PhD student at our Department of Anesthesia and Intensive Therapy, and I'm lucky that my mission and vision align completely with translational medicine, so let's move forward. I'm working on 3 articles right now, and there is a special reason why I chose these 3 topics, because if you may remember from the last progress report, liver diseases are exceptionally difficult when it comes to the context of anesthesia and critical care. And we would like to approach this problematic subject from 3 different angles, but let me give you a little background first. What makes it very different and exceptional is the so-called downward spiral in liver pathophysiology, where as liver continues to lose its function for this or that reason, it leads to other organs losing their functions as well. And toxic buildup keeps accumulating, liver gets damaged further, and this is a downward spiral. Everything goes wrong, and you end up with a multi-organ dysfunction syndrome. Now, in the surgical setting, this downward spiral is represented with up to 48% post-operative complication rates and up to 20% mortality. This is unacceptably high. And the situation is even more dire when it comes to the ICU. 61% of patients who are admitted to an ICU will experience liver function deterioration or liver dysfunction. And unfortunately, those who acquire this liver injury, the mortality rate can rise up to 86%. This is unbelievable. So in order to mitigate all of this and find a solution, we separated our 3 studies to 2 domains: the surgical setting and an ICU setting. In the surgical setting, we are going to approach preoperatively and perioperatively. First with the glucocorticoid administration and goal-directed fluid therapy. And in the ICU setting, we would like to see hemadsorption therapy as a life support system. Now, we chose our articles, we chose our modalities based on their feasibility, their affordability, the fact that they are easy to utilize in practice, easy to protocolize, and they have solid evidence behind them. Now, my first project is about the preoperative administration of glucocorticoids. This is against the dysregulated immune response that we see in liver pathophysiology. Our aim here is to analyze the data available from clinical trials in order to test the efficacy of glucocorticoids in reducing post-operative complication rates. This is our question, whether the rates are going down or not, and we hypothesize that it will. We are here administrating any kinds of glucocorticoids, natural or synthetic, and we are primarily interested in the overall post-operative complication rate. We did our systematic search in 3 databases. Here's our PRISMA flowchart. We ended up with 11 randomized controlled trials, all randomized, all blinded. Now, briefly, I will show you my primary outcome, because we actually ended up with 37 distinct outcomes, but I don't think anyone wants me to go over 37 outcomes today. So let's focus on my primary outcome. Here, as you can see, we have 9 out of 11 articles reporting this outcome, with a 39% heterogeneity, which for randomized trials, this is expected. We are here talking about a 20-year time period with studies from 6 different countries. This is natural. And the result that we have, as you can see, the statistical analysis ended up with a significant result in favor of glucocorticoid administration. From the odds ratio, you can see that those who took preoperative high-dose glucocorticoid are 40% less likely to experience any postoperative complications. But the prediction interval displays that we still could use further clinical trials. We also performed our risk of bias assessment, and as you can see, our articles are mostly good, some of the concerns, and you will see this repeated with other outcomes. Some of the articles they have some concern, but this is primarily because of phrasing and language. It's ambiguous language. Now, let me give you 2 examples of specific postoperative complications. One of them is wound infection. Our articles did not report every single complication one by one specifically. So you can see that the number of articles has been lowered. But here, for example, wound infections, this is a very serious postoperative complication. And with an odds ratio of 0.64, we can still see that the glucocorticoid administration has a statistically and clinically significant result. Same story with risk of bias. It's quite good, I believe. Now, in contrast, septic complications, here you can see the beginning of our problems. The lack of articles that are reporting distinct postoperative complications as outcomes. Here, for example, you can see that our result has not reached statistical significance, and the prediction interval is telling us that we need to work on this quite a bit. Same story with risk of bias. To summarize, what we have conducted is this meta-analysis with the largest participant pool size to date. All studies we included were randomized. There's an overall very low degree of heterogeneity in population, which is very good news for us. And by far, this was the most comprehensive meta-analysis on this subject. Our limitations, however, we did not distinguish between different major liver surgeries. Perhaps in the future, other clinical trials might try this. And unfortunately, certain studies that we used had some issues adhering to a standard when it came to outcome reporting. And for practice, this is a cheap, universally available medication that is shown to reduce overall complication rates. And for research, we highly suggest that future clinical trials should stick to a standardized and uniform reporting method for their outcomes. In conclusion, we saw that preoperative administration of steroids reduced the overall rate of postoperative complications. Some complications are actually better prevented than others. For example, high-grade liver failure was one of them. And we found no convincing evidence of any detriment associated with its use. My second project is about goal-directed fluid therapy in liver surgeries. This is the perioperative modality. This is, again, to reduce postoperative complications. Here, we would like to see the efficacy of GDFT in reducing complications. And here is our PICO. And our clinical question, at this point, we are in the systematic search phase because we have 25,000 results, and we kind of don't know what to do. Now, let's move on to my final project. This is the use of hemadsorption therapy for critically ill patients with acquired liver injury. And this is the ICU setting. Now, here, we would like to see that hemadsorption therapy prevents this downward spiral from ICU-acquired liver injury down to acute hepatic failure and mortality. But with this study, we aim to summarize and synthesize all currently available evidence on hemadsorption therapy to formulate hypothesis-generating arguments, because there is unfortunately a lack of randomized clinical trials in this subject. This is the question that we asked, and primarily we will be interested in mortality, liver function, and cytokine levels. We conducted our systematic search on 5 databases. Here's our flowchart. We are at the moment in the full text selection process. As you can see, we started all of our projects in last fall, and we plan to finish all of them by next fall. And let me leave you with my favorite quote of all time: the difference between screwing around and science is writing it down. Thank you very much. And if I may, this is a very good chance to ask 3 questions for the free bottles of wine.
Congratulations. This is actually a stupid question.
There is no stupid questions.
From where do you collect your motivation doing your PhD?
As a good friend of mine said, fake it till you make it.
Congratulations on your progress. Amazing results. I like your project. So my question is there a criteria for some patients who should receive steroids pre-operatively or not?
This is actually a very good point, because in the guidelines for enhanced recovery after surgery protocol, the ERAS protocol, it is already recommended to administer a dose of steroids before surgery. However, the evidence level and the strength of recommendation are not too strong. That's what we aim to change, because it is also in our interest with this meta-analysis to demonstrate that they are at least as safe as placebo. And so far, with the results that we have, this is very clear. So I also hope that in the future, more physicians will routinely administer a dose of glucocorticoids before liver surgery, for sure. And this is why I'm very excited about this subject, actually.
Fantastic, John. It's amazing. Actually, I have a comment regarding a question regarding your meta-analysis, first meta-analysis, sorry, and that all complication is your primary outcome. First of all, how would you define that all complication, all kind of complications? Right. I'm actually very curious, because it's kind of your questions previously, that in some of the articles there is a 50%, yeah, it's karma, yeah, it's 50% complication, and the others is like 5%, and of course it's very different. And I did not have the time to check whether, for example, you were showing infection-like complication, and I don't know if you put that infection also in that all complication plot.
Of course. So these septic complications and these wound infection complications are of course counted in overall postoperative complication rates. Now, this is a little bit of history, because until the beginning of 2010s, we didn't have a universally accepted way of reporting postoperative complications. Now we have several different classification systems. Most prominently, maybe you have seen the Clavi and Dindo classification system. But before that, in older studies, they were just happy enough, they were satisfied enough with clinical assessment. So this is why when we were extracting data and when we were analyzing our papers, we actually paid very close attention to make sure that if they say overall postoperative complication rate was, 25 people had complications, we made sure that all of the papers actually elaborated and explained what were those complications. So there is no complication here that is not accounted for in the full text.